One very common piece of advice parents hear during fever is, sponge the child with water. That will bring the fever down. Some parents use cold water, some use alcohol, and some keep sponging again and again. Today I will explain whether sponging actually helps during fever, how it helps, and how to do it safely. First, let us understand something very important. Fever is controlled by the brain, not by the skin. Inside the brain, there is a temperature control center called the hypothalamus. When a child has infection, this center raises the body's temperature set point. So during the rising phase of fever, the body is actively trying to stay warm, not cool down. Now imagine what happens if you apply cold water on the skin at this time. The brain thinks the body is losing heat. So it reacts by narrowing blood vessels in the skin, making the child shiver, trying even harder to raise the temperature. This can actually make the child more uncomfortable and sometimes even push the temperature higher inside. That is why cold sponging is not recommended. Now let me explain when sponging can actually help. After you give paracetamol, the brain lowers the temperature set point back toward normal. At this stage, the body starts trying to release heat instead of holding it in. This is when lukewarm sponging can help the body cool more comfortably. Now let me be very specific about the water temperature. The water should be lukewarm, around 29 to 32 degrees Celsius. Which means it should feel neutral or slightly warm to your hand, not cold. Never use ice cold water, very hot water, alcohol or spirit on the skin. Now let me explain how lukewarm sponging helps lower temperature. When you gently wipe the skin with lukewarm water, the water absorbs heat from the skin. The water then evaporates into the air. Evaporation carries heat away from the body. At the same time, because the water is not cold, it does not trigger shivering. So the brain does not try to raise the temperature again. This allows the body to cool in a gentle, natural way. Now let me explain how to do it safely. Use lukewarm water, around 29 to 32 degrees Celsius. Gently wipe the neck, armpits, groin, arms and legs. Do not scrub. Do not soak the child. Stop immediately if the child starts shivering. The child becomes very uncomfortable. The child starts crying or resisting. Now let me tell you something very important. Sponging does not treat the infection. Sponging does not cure fever. It only helps with comfort, and only in the right phase of fever. The main treatment for fever is rest, fluids, correct use of fever medicine, watching for danger signs. So let me leave you with a simple and safe message. Lukewarm sponging helps the body release heat. Cold sponging makes the body fight to stay hot. If your child is comfortable, drinking, and resting, you often do not need to sponge at all. If this video helped you, please like, subscribe, and share it with other parents. I'm Dr. Yatin Bhole.